Bismillahirrahmanirrahim. My affectionate students of AWMC 9, Assalamu alaikum wa rahmatullah. In my last class, we discussed about blood pressure, its regulation, hypertension, its causes, and classification of antihypertensive drug. Today's class, we will discuss about clinically used antihypertensive drugs, inshallah. Clinically used antihypertensive drugs can be categorized alphabetically. As for example, A, B, C, and D. A stands for ACEI and ARB. ACEI is angiotensin converting enzyme inhibitor. ARB is angiotensin receptor blocker. B is beta blockers, cardioselective beta blockers. C is CCB, calcium channel blocker, that is vasoselective calcium channel blockers. And D stands for diuretics, mostly thiazide. We are going to discuss about now ACEI. ACEI is angiotensin converting enzyme inhibitors. Angiotensin converting enzyme, its another name is kinase 2. This enzyme is very important for conversion of angiotensin 1 to angiotensin 2. It blocks this conversion of angiotensin 1 to angiotensin 2. Angiotensin 2, it has got three important effects. That is, it is a powerful vasoconstrictor, that is, it will increase peripheral resistance. It also releases aldosterone from zona glomerulosa that acts on the kidney, increases tubular reabsorption of sodium along with water, so there will be increases volume overload, there will increase venous return, increase stroke volume, cardiac output, and thereby blood pressure. It also releases adrenaline from adrenal medulla, which acts on alpha and beta receptor, stimulates it and causes rise of blood pressure. All these factors, angiotensin 2, all these factors leads to rise of blood pressure. On the other hand, this enzyme increases breakdown of bradykinin. Bradykinin causes vasodilation directly as well as indirectly by increasing prostaglandin release. So kinase 2 or ACEI, when drugs used like captopril or lisinopril, they will block this enzyme, and this angiotensin 2 mediated all the activities will be inhibited and ultimately follow blood pressure. So in this way, ACEI acts. And ARB, this is angiotensin receptor blocker. Angiotensin acts on its receptor, that is named as AT1. So angiotensin ARB, like losartan, valsartan, they will block the receptor and thereby angiotensin mediated activity will be, aldosterone mediated activity will be suppressed. And in this way, they will reduce blood pressure. Both the drugs has got more or less similar effect, adverse effect, like they will produce aphthous ulcer, they will produce glossitis, anorexia, neutropenia. And in case of ACEI, as there is increased level of bradykinin because its breakdown is inhibited so there will be irritation of the respiratory mucosa leading to dry cough, harassing cough, unproductive cough. But ARB, angiotensin receptor blockers, they will remain kinase 2 enzyme intact. That's why the bradykinin level will be normal and it will not produce any dry cough or unproductive cough. And both the drugs will produce hyperkalemia. They will increase the level of potassium in blood. Now, the indications of this group, they are used in case of hypertension, they are used in case of heart failure, they are used in case of diabetic nephropathy, and in case of following MI, these drugs are used. Now, these are the indications of these drugs, and now contraindications of this drug is there is bilateral or unilateral renal artery obstruction, aortic stenosis, any form of obstruction in front of the left ventricle, angiogenetic edema, and pregnancy. These drugs are contraindicated during pregnancy. And in situation where GFR is reduced to 30 ml per minute, in this situation, this drug should be avoided. Now, B stands for beta blocker. We use cardioselective beta blockers, like atenolol, metoprolol, bisoprolol. These drugs decreases all the parameter receptors in myocardium, all the parameters of heart, like force of contraction, like stroke volume, like heart rate, thereby cardiac output will be inhibited and leads to fall of blood pressure. Also, it will inhibit release of renin from juxtaglue apparatus and release induced blood pressure